Human metapneumovirus, HMPV, situation in India and China. China, decline in HMPV cases. Recent reports indicate a decline in human metapneumovirus, HMPV, infections in northern China. Wang Liping from the Chinese Center for Disease Control and Prevention noted that the recent increase in HMPV cases is due to improved detection methods. She confirmed that the virus is not new and has existed for decades, with most children infected by age 5. Public health measures. Health experts advise standard precautions, such as regular hand washing and wearing masks in crowded areas to prevent the spread of respiratory diseases. India. Isolated cases detected. 2 infants in Bengaluru have tested positive for HMPV. The Indian Union Health Ministry asserted there are no connections between these cases and the Chinese outbreak, emphasizing HMPV's global presence. Government response. The Union Health Ministry has stated that India is closely monitoring the situation and is well prepared to manage any potential rise in respiratory illnesses. The ministry noted that the surge in respiratory illnesses observed in China was consistent with seasonal flu patterns and that similar viruses are already circulating globally, including in India. As a precaution, the Indian Council of Medical Research, ICMR, will increase the number of laboratories testing for HMPV and will continue to monitor trends throughout the year. State-level advisory. In response to the situation in China, the Maharashtra State Health Department has issued a precautionary advisory emphasizing respiratory hygiene and avoiding public places when symptomatic. Health authorities are closely monitoring the situation, and while no rise in cases has been noted in India, vigilance remains high. In summary, while China has experienced a surge in HMPV cases with a recent decline, India has reported isolated cases and is taking precautionary measures to monitor and prevent any potential outbreaks. Both countries are emphasizing standard public health precautions to mitigate the spread of the virus. HMPV was first identified in 2001 in the Netherlands, but has likely been causing respiratory infections for decades before that. In late 2024, China experienced a surge in pediatric HMPV cases, leading to overwhelmed hospitals. In India, a few cases, including 2 infants in Bengaluru, were reported, raising public concerns. Cause: infection occurs when the virus enters the respiratory tract. Modes of transmission: respiratory droplets from coughing or sneezing, direct contact with contaminated surfaces or hands, close contact with infected individuals. Symptoms: mild fever, cough, nasal congestion, sore throat, and wheezing. Symptoms start after 3-6 days after exposure. Severe: bronchiolitis, pneumonia, hypoxia, and acute respiratory distress, especially in vulnerable populations. High-risk groups: children under 5 years, elderly individuals, immunocompromised patients, individuals with chronic conditions like asthma or COPD. Laboratory tests: RT-PCR, highly sensitive and specific for detecting HMPV RNA in respiratory samples. Immunofluorescence assays or serological tests used in some cases. Chest X-ray or CT scan for severe cases to identify pneumonia or bronchiolitis. Supportive care: rest and hydration, over-the-counter medications to relieve fever and pain. Hospitalization, oxygen therapy for hypoxia, required for severe cases involving respiratory distress. Mechanical ventilation in critical cases. Preventive measures: frequent hand washing, avoiding close contact with symptomatic individuals. Disinfection of commonly touched surfaces, wearing masks in crowded areas. China, initial surge overwhelmed hospitals, but cases are now declining. Authorities implemented monitoring systems and public awareness campaigns. Focus on hygiene practices and healthcare capacity. Indian Health Ministry reported no unusual surge, but increased surveillance. High-level meetings have been conducted to ensure hospitals are prepared for potential outbreaks. China. As of today, the situation in China is stabilizing, with health authorities reporting a decline in new HMPV cases, particularly in northern provinces. The government has increased public health campaigns, emphasizing mask wearing, vaccination drives for other respiratory illnesses, and improved hospital preparedness to handle future respiratory outbreaks. A national task force is monitoring the virus's spread and collaborating with international health agencies for better data sharing and response strategies. In India, the Health Ministry has reiterated that there is no major cause for concern as the reported cases remain isolated. A dedicated response team has been formed to track respiratory infections across the country. Plans include expanding RT-PCR testing capacity, setting up isolation wards in key hospitals, and launching awareness programs in schools and public spaces. Collaboration with WHO and other global health bodies ensures real-time updates on any significant changes in the situation. Lack of vaccines or antivirals. Unlike RSV, there are no specific vaccines or antiviral treatments for HMPV. Diagnostic overlap. Symptoms mimic other respiratory viruses, complicating timely identification. Healthcare burden. During peak seasons, hospitals face increased admissions, especially pediatric and geriatric wards. Research and development need for targeted vaccines and antiviral therapies. Ongoing research to better understand the virus's pathogenesis. Public health strategies. Enhanced surveillance to detect and monitor outbreaks. Importance of hygiene and early medical attention for respiratory symptoms. HMPV, while not new, is gaining attention due to its impact on vulnerable populations and its ability to strain healthcare systems during outbreaks. India and China's responses highlight the importance of preparedness, surveillance, and public awareness. Moving forward, global efforts must focus on developing vaccines, improving diagnostic tools, and strengthening healthcare infrastructure to mitigate the impact of HMPV and similar respiratory pathogens.